Hello, I'm here with Dr. Melhem Solh, an expert in diffuse large B-cell lymphoma, or DLBCL. In this video, we'll discuss the safety profile of Zynlonta. Dr. Solh, I understand the safety and tolerability of therapeutic option is of great importance to patients. What can you tell us about the safety profile of Zynlonta?
You're absolutely right. The significance of safety and tolerability for both the patient experience and the ability to follow the chosen treatment plan cannot be overstated. As we consider this information, it's important to remember that patients were heavily pretreated and had difficult to treat disease. For example, in LOTUS-2, patients had received 2 to 7 prior lines of therapy with a median of 3 lines of therapy. The median age was also increased at 66 years, and 14% of patients were age 75 or older. So if we look on the study design, the treatment continued until progressive disease or unacceptable toxicity for up to 1 year. The table here presents the adverse reactions, including any grade of adverse reactions that occurred in at least 10% of LOTUS-2 participants. You can see the incidence of grade 3 or 4 adverse reactions is also shown.
I see. That leads me to my next question. Did patients experience any serious adverse reactions?
Yes. Serious adverse reactions occurred in 28% of the patients. If we look at the most common serious adverse reactions that occurred in more than 2% of the patients, these were febrile neutropenia, pneumonia, edema, pleural effusion, and sepsis. There were fatal adverse reactions that occurred in 1%, and this was mainly due to infection. As far as permanent treatment discontinuation due to an adverse reaction, this occurred in 19% of patients. Adverse reactions that resulted in permanent discontinuation in more than 2% of the patients, these were an increased gamma GT, edema, and effusion. Now, if we continue on the safety results from the LOTUS-2 trial, you can see the select lab abnormalities that occurred in at least 10% of the patients.
Yes, Dr. Solh. Were there any adverse reactions that required dose interruption?
As a matter of fact, there were. Throughout the LOTUS-2 study, the Zynlonta dosage was interrupted for an adverse reaction in 49% of the patients, with things such as increased gamma GT, neutropenia, thrombocytopenia, and edema being the most common events. The Zynlonta dose was reduced for an adverse reaction in 8% of the patients, with increased gamma GT being the most common event. Here, I'd like to point out that Zynlonta full prescriber information provides recommendations for dose delays and modifications to address an adverse event.
Is it notable that there were no differences in safety or effectiveness between older and younger patients in LOTUS-2?
This is a very important finding, as many patients with relapsed or refractory diffuse large B-cell lymphoma are older. As we can see in the LOTUS-2 trial, the median age was 66, and 14% of the patients were more than 75 years of age.
The information you just shared is undoubtedly helpful to our viewers, and I'm wondering if we can provide even more details from the LOTUS-2 trial to help prepare care teams regarding Zynlonta safety and tolerability. I think it'd be valuable to know how specific adverse reactions were addressed.
I agree. Although each patient's circumstances and response to treatment are unique, this type of information would be very beneficial to care providers. So let's take a look at the recommended dose management of particular adverse reaction in the Zynlonta full prescriber information and how to dose modify based on what was been done in the LOTUS-2 study. The adverse events we'll look at are effusion and edema, myelosuppression, infections, and cutaneous reactions. So these are potentially serious adverse reactions that were seen with Zynlonta treatment, and most are included in the warnings and precautions section of the PI. Here, you can see the recommendations derived from the Zynlonta prescribing information for managing effusion and edema. And this includes the use of dexamethasone premedication, for example, to reduce the incidence of PPD-related adverse reactions, such as effusion, edema, and liver function test abnormalities. Now let's see the dose management of these adverse events in the LOTUS-2 study. As you see here, this is the incidence of dose delays, reductions, and withdrawals for effusion and edema. Based on the study protocol, dosage delays due to any adverse reactions were made before dose reductions, and the incidence of delays were always higher.
Thanks. This is very helpful. I imagine our viewers are interested in learning about management of myelosuppression. Could you address that next?
Of course. Let's again begin with the recommendations derived from the Zynlonta prescribing information. Regarding myelosuppression, prophylactic granulocyte colony stimulating factor administration may be considered as applicable. Here, I'd like to point out that Zynlonta full prescriber information provides recommendations for dose delays and modifications to address an adverse event. As for dosing, this chart presents the recommended dose modifications for neutropenia and thrombocytopenia. Now let's look at the dose management of myelosuppression in the LOTUS-2 trial. Here you can see the incidence of dose delays, reductions, and withdrawals for neutropenia, thrombocytopenia, and anemia.
Very interesting. As you mentioned before, I see that dosage delays were more frequent than dose reductions. So let's move on. Why don't we address infections next?
Okay. So the table on the screen here presents recommendations derived from the Zynlonta prescribing information. The recommended dose modifications for infections are shown here.
I see that again, if dosing is delayed by more than 3 weeks due to toxicity related to Zynlonta, subsequent doses should be reduced by 50%. And then if the toxicity recurs following dose reduction, treatment discontinuation should be considered.
Yes, that's very correct. This is the guidance for all of the adverse reactions we'll be discussing today. Now let's look at the dose management of infection in the LOTUS-2 trial. This chart here shows you the incidence of dose delays, reductions, and withdrawals for infection. And this includes, but is not limited to, upper respiratory tract infections such as upper respiratory tract congestion, upper respiratory tract nasopharyngitis, rhinitis, rhinoviral infection, and sinusitis.
Thanks for that. Again, I'm sure this information is helpful to those wanting to know more about Zynlonta's safety and tolerability. Let's take a look at cutaneous reactions next.
Certainly. The table on the screen here presents the recommendations derived from Zynlonta prescribing information. Let's review the guidance on dose modifications. You can see that there are recommendations specific to photosensitivity and rash. Now, if we look at dose management of cutaneous reactions in LOTUS-2, as you can see here, the incidence of dose delays, reductions, and withdrawals for cutaneous reactions. These data are broken out into photosensitivity cutaneous reactions and non-photosensitivity cutaneous reactions. Now, in case anyone is wondering what comprised cutaneous reactions, that would be rash, including those listed beneath the table, pruritus, and photosensitivity reaction.
I'm sure someone was wondering. So thanks for the explanation, and thanks for going through all of those details. Safety information is so important.
I couldn't agree more. You know, as a prescribing physician, I find those data very helpful, so hopefully our viewers will too. I'd also like to note that clinicians should refer to the Zynlonta prescribing information for guidance on addressing other adverse reactions as well. What's important to take away from this is that although LOTUS-2 investigators were able to address some of the adverse reactions reported here, you should always prioritize the Zynlonta PI recommendations as you manage patient care.
Dr. Solh, thanks so much for sharing your time and expertise in this area. We hope you found this discussion informative. To see more of our discussion, please watch the other videos available in this series. For additional information, you can visit ZynlontaHCP.com or your ADC Therapeutic sales representative. Now, please take a moment to view the important safety information for Zynlonta.